Heart disease is the #1 killer of women, but the founder and CEO of Ms. Medicine says even some doctors don't always take women's symptoms seriously. I spoke with Dr. Lisa Larkin about the danger and how to be an advocate for your own health. Dr. Larkin, happy February. We know that heart disease is the leading killer of women. So why do you think it is that only about 50% of women even know that fact?
Right. So this is really a concern because women worry largely about breast cancer, but about other cancers than breast cancer, and don't really think about heart disease. They think about that still as a male disease. And so we know only about 50% of women identify that correctly as the leading cause of death of women.
So how is heart disease in women different than how it presents in men?
So this is really an important thing, which is we now are understanding that there's huge gender differences in the ways disease that present in both men and women present. And so no surprise, cardiovascular disease is actually a different disease in women. Women have smaller arteries to their heart. They form plaque differently. And so no surprise, their symptoms are different and their management often needs to be different.
And there's also a relationship between menopause, those ages of menopause, and cardiovascular disease. What's the connection?
Right. So this is really important for women to understand. So we know that heart disease usually develops in women at several years later than men. We know that menopause is a time when there's huge physiologic changes that put women at higher risk. So these are all kinds of metabolic and vascular changes that happen. So change in lipids, change in vascular resistance, change in blood pressure, change in sensitivity to insulin and blood sugar. So these are really important factors, and it's a big change at menopause. What we also know, though, is that women don't optimize their lifestyle around the time of menopause. So one of the big focuses for women should be know your risk factors and really work at optimizing lifestyle to lower your risk.
So we talked a few months ago about hormone therapy now being recommended for women in that menopause age group, 60 and under, within 10 years of menopause. What are some other things that women need to do even before menopause? You talked about lifestyle to prevent heart disease.
Right. So as I said, heart disease is really different in women. And one of the things we now understand is that there are other risk factors in women that women need to be aware of that they're often not. And this includes hypertension during pregnancy or gestational diabetes. And so if you're a younger woman who's had pregnancy and has those risk factors, those are really things that you need to make sure that you're discussing with your doctor, even before you enter menopause. Now, the other thing about menopause is we know that the natural age of menopause for most women is 51. Women who have early menopause, so those are women in their 42, 45, they have a higher instance of cardiovascular disease. And what's really important is because there's been all this confusion about hormone therapy at the time of menopause, is it good or is it bad? And lots of women believe that it's bad. Lots of doctors still believe that it's bad. The truth is we now understand that when estrogen hormones are given at an appropriate time, they actually lower cardiovascular risk.
You also mentioned that the medical community sometimes fails women. What can we women do about that?
So as you know, Sheila, one of the most important things that I talk is about women having accurate information so that they can be better advocates for themselves. And so this in the area of heart disease in women, it's really important that women have adequate truthful information and they can really advocate for themselves with their physicians. This has been hormone therapy at menopause, women in cardiovascular disease. We've learned a lot in the last couple of years. It's confusing to women and to doctors. And so if you're not getting your questions answered, really advocate for yourself and find a clinician that really understands women and heart disease and hormone therapy at menopause.
Dr. Lisa Larkin, CEO and founder of Ms. Medicine. Thank you so much for your information today.
Thank you, as always, Sheila.